Simulation training in general is trying to reproduce the real environment in which we work.
You're doing a very good job.
Our learners for this course are often experienced clinicians that are now doing healthcare education.
Can't imagine what you must be going through. How long have you been here in the hospital?
Taking the iSIM course is particularly important because it fits so nicely into our role as instructors.
What was your thought process as to who was taking the leader role?
The idea that because you're a good clinician, you're a good educator doesn't always translate. They're different skill sets. And so we're here really to give them those skill sets.
We want them to verify this, that there is no pulse.
We're a group of active duty Army soldiers whose mission is to train deploying forward surgical teams. And it's a chance to review some of the unique aspects of medical care.
If the patient wants to be fib, that's the first thing you have to do.
The initial few days are primarily didactic in nature, but we make sure that they are prepared then to go into a mass casualty exercise, which involves human actors, high-tech simulators, and some low-tech simulators.
Sir, what's going on?
That mimic a bunch of different battle casualty injuries, as well as other common scenarios.
Am I getting any reaction to an narcan?
So much of what we do in healthcare occurs in teams. Training those teams to be effective, high-functioning teams is really important.
But the specific team, if they don't work together regularly, they really have not maximized those team dynamics.
So you didn't say yes or no, and then she assumed that was a yes?
Both really the clinical and the teamwork dynamic plays such an important role in the ultimate outcome of trauma patients.
What we want them to think about and go through the process of how do we develop effective curricula using simulation, what equipment they need, how are we going to then debrief and have conversations around what happens in the simulations.
Following a certain structure in your mind.
We usually use our joint trauma system that has many of our clinical practice guidelines, and that's what allows these teams to then continue to practice what we teach them here.
Makes them feel more confident in what they do. Bringing that level of impact to patients is really amazing.